everybody. How's everyone doing today? I know I'm a few minutes late. I was actually out seeing a patient and I didn't want to cut it short. You know, I never want to shortchange my patient. So I knew I was going to be a little bit late to the broadcast today, but that's okay as long as we make it, right? You got to do it until you make it. I'm not even going to fake it till I make it. I'm just going to do it until I make it. All right. Give me a second to, just share this video because I was out seeing patients this afternoon, so I didn't get a chance to do my usual promotion of my talk today. So I'm going to just share this post really quick here so that some folks can come on and join us. How's everybody doing out there today? How's everyone doing? Let's see. I hope you all are doing well. It is Super Bowl Sunday. Y'all know that? I'm sure you do. It is Super Bowl Sunday. And my team is not playing, so, you know, I'll watch it, but, you know, neither one of my teams are playing. I'll say that. So I don't really have a dog in this fight. So, but I am going to just kind of check it out. Just for the fun of it. But it is Super Bowl Sunday. So it is February 4th, 2018. It is a Sunday. It is 3:15 p.m. And this is Talk with the Doc. And you all know who I am. I am Dr. Nicole, your board-certified family medicine physician. I specialize in managing, treating, and preventing chronic medical conditions and explaining those conditions in terms that everyday people can understand. Through my seminars, my concierge medical practice, and my book's getting ready to come out, y'all. I help pastors and their congregations, professionals who are overworked, overwhelmed, and overweight to transform their mind, body, and spirit so that they can have a greater impact on everyone around them. That's their congregations, their children, their communities, everybody, right? So like I said, I got my book is getting ready to come out. We're going to be doing our doing the launch here near the end of the month. So I invite you guys, if you want to pre-order your autographed copy of the book, you can go to divinehealthbook.com. That's divinehealthbook.com. And you can pre-order the book. It is called The 12 Secrets of Divine Health. Don't you want to be healthy? Don't you want to know what the secret is to being healthy? Don't you want to know the secret to having this healthy skin and energy and a healthy heart and a healthy mind, healthy spirit? If you want to know what the secrets are, please pre-order my book, divinehealthbook.com. You can go on and pre-order your autographed copy today, right? All right, so this is February. Yay, we're in February. And as you can see, I have on my red dress. It is nationally, lots of people are doing the National Wear a Red Dress for Heart Disease Day today. All right, so lots of churches, you'll see they wore a red dress on Friday. My sorority, Alpha Kappa Alpha Sorority Incorporated, our colors are pink, but pink went red on Friday. So we all wore red on Friday to show our support for heart disease as well. So February we typically know this as the month of love, all right? We do everything about hearts for February. It's Valentine's Day. It is the American Heart Disease Awareness Month. It is Go Red for Women. Yeah, because it's all about learning and treating and preventing heart disease in women. We do know that the numbers of heart disease in women are going up. We don't want that, right? So if we become more aware of heart disease, if you guys are watching the broadcast, go ahead and shoot me a comment so I can say hi to you, so I can know who you are. So like I said, we want people to be more aware of heart disease. So we're doing all these campaigns, like I said, the Go Red for Women, Wear a Red Dress Day, Pink Goes Red for Heart Disease. So yeah, it's all about heart disease. So like I told you last week, all for the month of February on Talk with the Doc, we are going to be doing Heart 101. Are you guys ready to learn? Are you ready to get in to school, get into the academy, getting some knowledge about heart disease so that you can prevent it, so that you can hopefully not have to deal with it with somebody you love or with yourself, right? So lots of people who I know have heart disease. Hey there, Miss Lakia, thanks for joining in. Lots of people who I know have heart disease. Of course, like I said, I'm a board certified family medicine physician. Hey, Dr. Greg, thanks for joining in. So I treat lots of people with heart disease, but how many of you know that I have some very close family members? My own father, who I love dearly, he's dealing with heart disease. And when he moved down to South Carolina, he went through and had to get a procedure done to his heart because of heart disease, right? And so it's in my family, I know like my grandparents had heart disease, and I've got aunts and uncles with heart disease. I've got close friends with heart disease. And when when you hear about something and it affects other people, it's like, okay, it affects other people. But when it affects your own household, when it affects those people who are close to you and who you love, and when you have to watch them go through, that's when it really affects you, right? And that's when you really want to do something about it. And that's when, I'm striving. I know it's in my genetics, but I want to make sure that my children hopefully won't have to deal with it, like how I've had to deal with it, or how I've had to watch my parents deal with it, or my grandparents deal with it. So it's all about knowledge so we can do some more prevention, right? So today on Heart 101, last week on Heart 101, we discussed the anatomy of the heart. Remember, we talked about the two atrium at the top of the heart that squeeze, and the two ventricles at the bottom of the heart that squeeze, and that's how they push blood out of the heart, and it goes around your body, and it comes back in, and then it goes to your lungs, and then it comes back in, and then it just keeps that cycle up. So today I want to talk about blood pressure, all right? So why is that important? Why? Well, what is blood pressure? First of all, blood pressure is the pressure in our hearts when the heart squeezes and when the heart relaxes, all right? So you've all heard of high blood pressure. Hey, Dr. Alexia, thanks for joining in. I appreciate you joining in and watching today. So we all know about, we've heard of high blood pressure or blood pressure. So blood pressure consists of two numbers, a systolic, which is the number on the top, and the diastolic, which is the number on the bottom. So you've heard people say, oh, the blood pressure that you're aiming for is 120 over 80. So 120 is your systolic, that's the number on the top. Diastolic is the 80, that's the number on the bottom. So what do those numbers mean? So the systolic is the pressure that the heart has to push against when it squeezes. Remember last week we talked about when the heart squeezes, it's pushing the blood out into the aorta, into the rest of the body. So when the heart squeezes, if you have narrowed blood vessels, if you have plaque in the arteries, if you have some other problems with your arteries, then the heart has to put more pressure to squeeze, right? So the more pressure the heart squeezes against, that's what makes that top number high, okay? So that top number, the systolic, is the pressure in the heart, pressure that the heart has to squeeze through to get the blood out of the heart, all right? So the diastolic is the bottom number. That is the pressure in the heart when the heart relaxes. So when the heart squeezes, that's the lub. When it relaxes, that's the dub. So lub dub, lub dub, lub dub. All right, so we squeeze and then we relax. So I've heard a lot of people say, oh, that bottom number, it might be 90 or 94 or 95 or 100, but it doesn't matter because my top number is good. Well, let me explain to you what the bottom number is. The bottom number is the amount of pressure in the heart when the heart relaxes. Why does that matter? Because when the heart relaxes, that's when it fills with blood, okay? So when it fills with blood, so the heart, like I said, we talked about last week, it goes out of the aorta, goes through the rest of the body, it comes in through the inferior vena cava, it comes into the atrium, and then when it then it goes out to the pulmonary arteries, the pulmonary veins, and it comes into the pulmonary artery. So when the blood comes back into the atrium, and it has to go down into the ventricle to squeeze out to go to the rest of the body again, if there's too much pressure around the heart, so if there's pressure around the heart and the heart can't relax, well then a lot of blood cannot get into the heart, all right? So if your heart's supposed to be like this, and all this is supposed to fill with blood, and then that's supposed to squeeze out, well, if you've got a lot of pressure on your heart, so your heart is only this big, okay, and then, so that's less blood that can get into the heart, right? So then when it pushes out, that's less blood that'll be pushing out. So where does all that blood go? Good question, right? All that blood then is pooling. It pools in your lungs. It can then pool in your ankles. it can pool in your other vessels, in your other veins. And so that's why we can get pulmonary edema or swelling in the or fluid in the lungs. We can get swelling in our ankles and fluid in our ankles. And so when your diastolic pressure is high, don't discount that bottom number. Don't say, oh, well, I'm 130 on the top and I'm 94 on the bottom, but it's still good. Or even I'm 120 on the top and I'm 92 on the bottom. That's still not good, okay? All right, so now that you know what it is, the systolic, that number on the top, is when the heart squeezes. That's how much pressure it has to squeeze against. And the diastolic is how much pressure is around the heart so that when the heart relaxes. So why does that, what numbers are we shooting for? We are shooting now for 120 over 80. We've always shot for that, right? But now a couple of, this was back, I believe, in November or December, they changed the guidelines, okay? So before it used to be 120 over 80 was considered normal. If you were between 120, 130 and 140 over 80 to 90, you were considered pre-hypertension. Then if you went from 140 to 160, and then 90 to 100, you were considered stage 1 hypertension. And then if you were above 160 or above 100 on the bottom, then you were considered stage 2 hypertension. Well, American Heart Association got together with some other boards, and they changed the guidelines for what blood pressure is supposed to be. So now what it is 120 over 80 is the goal. And if you are outside of the 120, so if you are at 130 and you are above 80, so if you are 130 over 90, you are now considered hypertension. All right. So there's no more pre-hypertension, no more stage 1. Either you don't have it or you do. Okay. So what does that mean? It means a lot of people who were kind of in that borderline, like, oh, it's just up a little bit. Now it means that they actually qualify and they actually have high blood pressure. All right. So what does that mean? People are like, oh, that's just the pharmaceutical companies and they're just trying to get more money to get more people on medicine. Not necessarily. Because if you come into my office and you have a 134 over 90 blood pressure, I'm not going to just throw medicine at you on day one. All right. First thing we're going to do is we're going to talk about lifestyle modification, and we're going to talk about history and what's in your history and what did you eat and what are you eating? Are you smoking? Are you drinking a lot? Are you under a lot of stress? Are you exercising? Are you drinking your water? Because these are the things we'll talk about in a minute that can lower your blood pressure. All right. So we're going to talk about those things. And then, so I'm not just going to throw a pill at you, because technically the definition of hypertension is to have three elevated blood pressure readings on 3 different occasions. So you got to have 3 different readings. So if you come in my office today and it's up, I'm probably just going to bring you back in a week or 2. We're going to check it again. If it's up then, I'm going to give you a look. As my sister calls it, the Dora blinks. Like, excuse me, ma'am, why is this blood pressure still up? And then we'll bring you back a 3rd time. And if it's up that 3rd time, that's when we got to do something about it. All right. So I'm going to give you a little chance. I'm going to give you a chance to get it down. But we do want that blood pressure to be 120 over 80. And why do we want it that low? Because, hey, Cassandra, thanks for listening. Please share this. Pushing more graceful lifestyle change. Yeah, that's true, Dr. Alexia. That is so very true. We are trying to avoid a heart attack. So, but Dr. Alexia is saying that before, if you were kind of in that pre-diabetic zone, we kind of talked to you a little bit about lifestyle changes, but now we are really talking about it hard. Hey, Miss Celeste, thanks for watching. Please share this video. Yes, Miss Cassandra, call me and make an appointment so that I can come see you or you can come see me. Either way. So what does high blood pressure do? When your heart, think of your heart like a muscle, okay? And just like when you're in the gym and you're building your muscles and you're pumping the iron to build your muscles, same thing with your heart, right? So your heart is having to work hard. It's having to squeeze against all this pressure. And what happens when that happens? Your heart gets big. That's not good, though. We want our biceps and our triceps and our quadriceps to be big, but we don't want the heart muscle to be big. That's not good, okay? Well, when the heart muscle gets big, we call that left ventricular hypertrophy, okay? We can see it. The heart muscle is big. It means it's going to get tired a little too soon. Hey, Miss Tia, thanks for joining in. If it gets too big, then, again, that lowers the amount of space that the heart has to fill up with blood, and then it can cause some heart failure in the future. It can cause blood to pool in places that we don't want it to pool, okay? So we are trying to prevent the heart from getting too big. We're trying to prevent that high blood pressure, because what happens if we have high blood pressure for too long? Then that leads to strokes. It leads to, hey, Superior, thanks for joining in. It leads to strokes. It leads to and heart attacks. All right. So if the heart is pumping too hard and it gets tired, come on, y'all. We don't want tired hearts now. All right. We don't want tired hearts. If that heart is overworking, it's going to get tired, and then it can lead to heart attacks. It can lead to heart failure. All right. It can lead to other, like I said, strokes. So you could be passing clots, and you don't want to do that. All right. So again, the goal for the blood pressure, 120 on the top, 80 on the bottom. So what lifestyle things can you do today if you know that your blood pressure is kind of in that borderline, I'm almost there, I'm not quite low where I need to be? Oh, and let me just say this while we're on the subject. Don't tell me or your doctor when you come into the office, oh, that's normal for me. No, honey, we don't, that's not normal for you. Okay, 140 over 90, that's normal for me. No, that's not normal for anyone. Okay, and it's not going to be accepted because we're trying to prevent you from having heart attacks and strokes. All right, so that's not normal. We're going to count 120 over 80. That's what we're going to count as normal, or below. All right, that's what we're going to count as normal. So what lifestyle modifications can you do today to help improve your blood pressure? Well, first of all, you can limit your sodium. All right, so sodium increases the blood pressure. All right, and sodium is in so many things. All right, so I've got, we all know table salt. Okay, so fine, I won't add table salt when I eat. Well, it's in more than that. Sometimes we cooking with salt. If you have something in your cabinet called garlic salt or onion salt, that all has salt in it. If you have Lowry's or Johnny seasoning, salt. It's all salt. Okay, that's all sodium. But those, of course, are some, we all kind of know that that's salt. But there are some hidden salts that we don't know about. How many of you cook with that onion soup mix? Do you? I know like some folks in my family cook with that. You sometimes use 1 and 2 packages of it to season their meat and stuff. Onion soup mix has 1,600 milligrams of sodium. 1,600, okay? And people are using multiple soup mix packets. Now, the goal for sodium for a day is 2,000 milligrams, or 2 grams of salt a day. 2 grams. And there's 1,600 in one onion soup package. That's a lot of salt. Or in the ramen noodle packet, there's about 600 milligrams in that ramen noodle packet. Sodium is used to preserve things. So when you eat meat that is in a package, so salami, bologna, ham, even turkey, you think, oh, I'm going to eat turkey, it's healthier. But if you open that package and there's that fluid, that salty fluid in that package, that is sodium. That is what they use to preserve it. That's why the stuff in the, hey doc, thanks for joining in. That's why the package in the packaged meat can last up to a month, because it's preserved in sodium. That's why when you go to the deli and you actually have them slice the meat, it only lasts for what, maybe a week or 2, and then it goes bad, right? Why? Because that doesn't have the sodium to preserve it. So you want to avoid the packaged meats. Packaged anything really has sodium in it to preserve it. Even packaged canned vegetables. So you're like, okay, doc, I'm trying to eat more vegetables. Well, if you're eating the canned vegetables, that's got sodium in it. So you either need to do one of 2 things. One, get the low sodium vegetables. Okay, that's a little bit better. And then 2, you want to rinse those canned vegetables off. If you have to use the can, rinse them off. All right. The healthiest thing to do, though, is to eat them fresh or to eat them frozen, because those don't have the high sodium content. All right. By limiting your sodium, you can bring down your blood pressure. All right. So that's step number 1, limit your sodium. Step number 2, exercise. Exercise. You gotta exercise. All right. We do know we recommend 30 minutes 5 days a week at minimum. Minimum. I'd like you to do more, but minimum, give me 30 minutes 5 days a week. It doesn't have to be all at once. You can break it up. You can do 10, 10, and 10. You can do 15 and 15. You can break it up, but your heart rate needs to get up. You need to be a little bit out of breath, all right? Maybe sweating a little bit, all right, to get a good exercise. By exercising 30 minutes a day, 5 days a week at a minimum, you can bring down your blood pressure, that top number, that systolic, you can bring that down 5 to 10 points. 5 to 10 points. Just by exercising, all right? So if you have high blood pressure, or you're kind of on that borderline and you don't want to get on pills, you don't want to put more money in the pharmaceutical CEOs? I know I don't. You don't either? Okay, good. Then exercise. Exercise. Get your exercise on. Go take a walk. All right? Park farther away at the grocery store. Take the stairs instead of the elevator. Get your heart rate going 5 days a week. That will lower your blood pressure. All right? If you are a smoker, stop. That's all I'm going to say. If you're a smoker, stop it. Stop it. Come see me. I can help you stop. We can get you some assistance to help stop, because we do know that smoking increases your blood pressure, all right? It causes plaque in your arteries. Then your heart is having to work harder. It's having to squeeze harder to get that blood out, okay? And then smoking, it's bad for you. Bad for your lungs, bad for your blood pressure, bad for your heart. It's just bad. Just bad for your skin, bad for your teeth. Just stop it. Stop it. I know it's addictive. Stop it. Stop it, all right? And we can help you if that's a problem for you. All right, what else can you do for blood pressure? You can, let's see, I said exercise, I said your diet, limiting your sodium. Okay, you got to increase your water intake, all right? You got to drink more water. So if you are dehydrated, then your heart is having to work harder to get that little bit of blood that you do have up to the brain and back around to the heart to keep it pumping, right? So if you're drinking more water, you are helping, then the heart doesn't have to work as hard to get the blood around and through the body. All right, so drink more water. How much water, doc? You should be drinking half of your body weight in water every day. Half of your body weight in ounces. So if you weigh 100 pounds, lucky you. No, maybe not. If you weigh 100 pounds, 50 ounces of water a day. If you weigh 200 pounds, 100 ounces of water a day. If you weigh 300 pounds, 150 ounces of water a day, right? Okay, and so you'll know you're drinking enough water because your skin will be nice and moisturized, your urine will be a nice clear color, and your blood pressure will be down lower, all right? So drink your water. All right, if you do have high blood pressure, or if you think it might be high, if you're having symptoms of high blood pressure, things like headaches, blurry vision, swollen ankles, chest discomfort, you need to go and get your blood pressure checked. Now, would I prefer that you come into a doctor's office and get it checked? Absolutely. But do you have to? No. Okay. Now they have blood pressure machines at the pharmacy. They have blood pressure machines at the grocery store. They have blood pressure machines. Sometimes I think I've seen one in the airport. Okay. Go and get your blood pressure checked. If you are seeing that your blood pressure is over one out of the 120s, so 130 or above on the top, and 90 or above on the bottom, you need to go ahead and see your doctor. Okay, make an appointment and see your doctor. Now, I want to go back a little bit about the symptoms of high blood pressure. Do you know why blood pressure is called the silent killer? Anybody? Anybody? Okay, well, blood pressure is called the silent killer. High blood pressure is called the silent killer because lots of times you don't get symptoms. You don't know that your blood pressure is up until you happen to check it, right? So for that reason, you need to be checking frequently as we get older. If you have a family history, if somebody, your mom or your grandma or your aunt or someone in your family had high blood pressure, you need to be checking your blood pressure. And then just routinely, you need to be going to get a physical, okay? And you need to be getting checked up at least 1 or 2 times a year to make sure that you don't have high blood pressure, because it can sneak up on you and you don't even know it, right? And your heart's been working hard all this time and you didn't even know it, and all of a sudden your heart conks out and you have a heart attack. And you're like, why? I didn't even know. Why? High blood pressure is the silent killer, because sometimes you don't get symptoms until your blood pressure is ridiculously high. Now, sometimes I do see my patients that come in, they've had headaches and their blood pressure is like what we call, you've heard, I'm sure, stroke level. I don't know what the definition of stroke level is technically. If you have high blood pressure, I don't care if it's 140 or 150, you could have a stroke, all right? But typically when people say stroke level, they're talking about above 160 on the top and above 100 on the bottom, okay? So that's when they say you have stroke level blood pressure. And if that's the case, then you will be started on medication if you're that high, okay? There are lots of different kinds of medication out there to treat high blood pressure. There's water pills. There's pills that slow down the heart rate. There's pills that take away the pressure in the heart. There's pills that work on the kidneys to lower how the kidneys are. It's a lot. There's all kinds of different medications. Snuck up on me. Yeah, doc. It'll do that. Yeah, and the blood vessels in your eyes, absolutely, they can burst. So if the blood pressure is too high and it's pushing hard, it can make blood vessels pop. All right, that's how people can get bleeding strokes in their brain. All right, their blood pressure is too high, they get an aneurysm or something pops in their brain. That's it. That's it. It's a bleeding stroke. All right. We call that, excuse me, a hemorrhagic stroke or a bleeding stroke. And we'll talk about strokes in another month. All right. So, guys, we got to get more information and more education about our blood pressures. I want you to check your blood pressure. What I tell my patients too, if you have high blood pressure, most of the time you're going to see your doctor every 3 months. If it's, if they're trying to get you controlled. Sometimes if you're just starting pills, it'll be every 2 weeks or every 4 weeks to make sure that you're on the right amount of medicine. And then I like to tell people this too. Just because you're started on the medication doesn't mean you have to take that medicine for life. Not all medicines. Some of them you do, but not all medications are a death sentence or I got to take this for life. Sometimes if you do the right thing and you are eating the right amount of fruits and vegetables and limiting your red meats and limiting your alcohol, you're exercising, you are getting enough sleep, you're lowering your stress levels, you are drinking enough water, then it is possible that we might be able to wean you down off your medicines. What I tell my patients is when you're ready to get off your medicine and you are ready to make the lifestyle changes necessary, then we will log we'll log your blood pressures. And then if we start to see them coming down, then we'll do a trial where we can wean down on your medicines, all right? So log your blood pressures. Sometimes people do get what's called white coat hypertension, where their blood pressure goes up sky high because they're nervous in the doctor's office. Maybe they were angry about the copay that they had to pay, or the sick people in the waiting room, or the long wait that they had to wait, or that they had to take off work to come to the doctor. So blood pressure goes up. And then when you check it at home, it's normal, okay? So that's called white coat hypertension. I don't always fly for that. So sometimes I have my patients bring their meter in to my office. We check both their meter and my meter, make sure that they're equal, that they're the same, and then I have them monitor their readings at home, and then we can adjust their regimen, their blood pressure regimen, medications, and lifestyle treatments based off of their home readings, all right? So know your numbers, guys. Know your numbers. Know what your blood pressure is, okay? That's so important. All right, I know that was a lot of information, but I wanted to educate you on what blood pressure is, right? So we talked a little bit about a lot of things. I didn't really get too much into the history, but like I said, if you do have a family history of high blood pressure, please check your pressure. There is something called primary hypertension and secondary hypertension. Primary is when your blood pressure is just up because it's up. Secondary hypertension means your blood pressure is up because of something else. So if you have maybe a tumor on your adrenal adenoma or a kidney, problems with your kidneys, your blood pressure, if you have problems with your thyroid, it can make your blood pressure go up. If you have problems with your adrenal glands, your blood pressure can go up. Like I said, kidney problems, then that would be called secondary hypertension. Sometimes if we just fix the other thing, your hypertension goes away. There's hypertension that happens when you're pregnant sometimes. So sometimes if you just treat it while you're pregnant and then once your pregnancy is over, your blood pressure can go back down to normal, then that's a secondary hypertension, all right? So like I said, there's all kinds of different types of hypertension, but the key is knowing your numbers. So know what your numbers are. Your top number is your systolic number, your bottom number is your diastolic number, and the goal is 120/80, and you can help manage your blood pressure by eating healthy, okay, limiting your sodium, getting your exercise, drinking plenty of water, stop smoking, all right, and lower your stress levels. When you're stressed, your blood pressure goes sky high, period, okay? Lower your stress levels. It'll help with your blood pressure. And make sure you're getting enough sleep too. All right. So that's all I wanted to talk about today. Just kind of a Heart 101 on blood pressure. We're on module 2, blood pressure. Last week was module 1. We talked all about anatomy. You can go on my website, on Facebook, Dr. Nicole D.O. That's DrNicole.do. And you can find all my videos. And last week we talked about module 1. We talked about the anatomy of the heart. This was module 2. We talked about high blood pressure. Next week on module 3, let me tell you what we're going to talk about next week. Let me see. I got to pull it up here. Next week on module 3, we're going to talk about heart attacks. All right. What is a heart attack? What causes a heart attack? What happens to the heart when it has an attack? All right. Myocardial infarctions, all those big words. I'm going to break them down for you. So next week, join me same time, same place, on Facebook here, 3 p.m. Eastern Standard Time for part 3, module 3 of Heart 101, right? And we're going to talk about heart attacks. So thank you so much for joining me today on Talk with the Doc. I hope you've learned a lot. I hope you've learned all about high blood pressure, how you can help prevent it, how you can help treat it, and how you can lower yours. Thank you so much again for joining me. You all know who I am. I'm Dr. Nicole, your board-certified family medicine physician. I specialize in managing, treating, and preventing chronic medical conditions and explaining those conditions in terms that everyday people can understand. Through my books, my seminars, and my concierge medical practice, I help pastors and their congregations, people who are overworked, overwhelmed, and overweight, to transform their minds, their bodies, and their spirits so that they can have a greater impact on everyone around them, their congregations, their children, and their communities. Thanks so much again for joining me on this week's episode of Talk with the Doc. Thanks so much, Tia. Please share this video. I appreciate it. And like I said, join me next week. Oh, and one last thing. Please go and pre-order my book. It's coming out at the end of this month, The 12 Secrets to Divine Health. Do you want to be healthy? Do you want to get healthy? And even if you don't, I'm sure you know somebody who wants to get healthy. I hope you do, though. I really hope you do. So I have written a book, The 12 Secrets to Divine Health, and I'm going to help you get healthy, okay? And I'm not telling you stuff that I read about. Well, kind of, sort of I am. But I'm really telling you stuff that I know, all right? So you can go to divinehealthbook.com and pre-order your autographed copy today. That's divinehealthbook.com. I hope that everyone goes and they buy a book, and I will see you all next week, all right? For Talk with the Doc. Dr. Nicole signing out.